So when the pandemic hit in 2020, governments obviously had to respond urgently to mitigate these impacts. But little was known really about the efficiency of the new fiscal and monetary schemes put in place and what were the potential unintended consequences, especially for the most vulnerable groups in society. So that's why IDRC quickly made the decision to redirect a lot of its funding to rapid pandemic response. And that's what this core initiative came to be, the core initiative. So this core initiative is actually, I think, supported about 20 research projects in 42 countries to do what? Well, to try to inform policy responses with timely and rigorous evidence from experts living and working in the countries that were feeling the effects of COVID. So CORE's mission has been to improve the understanding of the socioeconomic impacts of the pandemic and improving existing responses and to generate better policy options for recovery. This research has been, as you'll hear, and as you may have heard in the last session last week about informality, it's really been producing a rich set of findings around these impacts. So researchers working with governments responding to the crisis have produced a range of monetary and fiscal policy recommendations for longer term recovery and for future resilience. And so the research coming out of this cohort has been really informing the macroeconomic response in multiple countries. So I think anybody that's involved in this research initiative should be feeling very, very proud of that. They've touched on things such as like interest rate policies, progressive taxation and trade policies, and many more. And you'll hear more about that later on from our three panelists, who are Jessica just mentioned, from PEP, from the South African Institute of International Affairs, based in South Africa, and from an advisor to the Cambodian Development Resource Institute, who have generated rigorous and localized evidence on the heterogeneous economic impacts of the pandemic and recommended strategies for building back better. So as the core initiative will soon close in the next few months, it's really just an important time to collate knowledge, the knowledge that's been gained over these last 24 or so months, and share lessons from your experiences studying fiscal monetary policies globally. The recovery from the pandemic is unequal and long, and is already colliding with so many other crises, environmental issues, humanitarian crises. I think we're calling it the polycrises, season of polycrises. But this is why we must bring these learnings forward with a view of strengthening macroeconomic policies and ensuring that countries in the developing world are better positioned for future crises. So on behalf of IDRC, I'd like to thank our three panelists, the event organizers, and the participants for taking part in this important discussion today, highlighting what can be done to improve our country's resilience to future shocks. And I really look forward to hearing getting into the meat of, well, and what now, right? I mean, having this information is the first big step. And some of the recommendations may seem quite obvious, but what is different is that these recommendations are based on evidence and rigorous research that can be used as, in a sense, advocacy tools for governments and decision makers to say, these are the facts, this is what we found in this rigorous research. Let us help you to revise policies, to have a wider net when looking at social protection policies, etc. So anyway, I'm looking forward to it. And I'm going to hand it back now to Jessica.
Thanks, Erin. Thank you for starting us off, and for quite rightly, I think what I took out of your comment was the "and what now? What next? Where does this go?" So to start us off today, we're going to hand over to James at IDS, who's going to give a very quick overview of the key issues guide that you should all have had shared, which was a rapid review of the literature available on the topic of shockproof and inclusive fiscal policy. So James, I'll pass over to you.
Thanks, Jess. Right. Yeah, so what we do at IDS to support core is we provide, we look for cross-cutting areas of learning and we try to synthesize those in short briefings. So I'm just going to give you a very quick summary of what that synthesis looks like when we focused in on fiscal and monetary policy before we dive in to hear from the real experts who've been conducting this research in particular locations. Actually, a year ago, we carried out an initial assessment of what learning was emerging from across core. And at that time, it already showed there was a strong area of learning around what we called then shockproof and inclusive fiscal policies. So a year on from producing that snapshot, we have a lot more evidence from core that's been published subsequently that has further bolstered that kind of area of learning. The profound socio-economic impacts of COVID in low and middle income countries is obviously widely documented, and we know that governments were faced with responding urgently to mitigate such effects, especially for the most vulnerable. And the core research that's been produced has provided a rich set of findings around these impacts and provided a lot of knowledge and evidence that might help us prepare for future shocks through fiscal and monetary measures and social policies. So these are the kind of the main areas of learning that the short summary document we've produced covers. And this learning is primarily based on core research, although it does reference some other research as well on the fiscal dimensions of the crisis. And it sets out some analysis of how low and middle income countries were impacted economically and what some of their key vulnerabilities were at the start of the crisis. And it goes on to suggest some measures for improving resilience against the extreme shocks, economic shocks of such a global crisis. And the paper sets out a number of monetary, fiscal and social measures that could be used to alleviate both the longer term economic impacts of COVID-19, but also would help improve countries' protection against future crises, whether they're health related or not, in particular supporting the most vulnerable citizens. So some of the key issues, and as I say, this is a bit of a broad look across the whole cohort, but you're going to be able to dive into some of these more deeply in a moment when you hear from our presenters. So obviously it's well known that, the pandemic had a major negative impact on the global economy, but we know that this was much more severe in low and middle income countries, although there is significant variation between different lower income countries themselves. And the pandemic highlighted many existing economic structural weaknesses. And these structural weaknesses included weak digital economies, a lack of financial and social inclusion, as well as poorly developed domestic financial markets. And many low-income countries followed or follow still pro-cyclical policies that failed to save during periods of growth, and this made them extremely vulnerable to such a sudden economic shock. Research from core suggests that longer term, we may need to see strengthened social protection systems and public health, but also formalization of labour markets and the creation of fiscal buffers. Another area that's been highlighted by core research is the impact of countries' credit ratings. Poor sovereign credit ratings diminish a country's ability to pursue expansionary fiscal policies when they are needed during a crisis like COVID. And all countries, whether they were low-income countries or high-income countries, saw their credit ratings hit very hard during COVID. And this included the rating downgrades of 7 sub-Saharan African countries since March 2020, which includes some of the region's biggest economies. And what core researchers are recommending is it doesn't actually have to be this way. Credit rating agencies could suspend their assessments for developing countries until global production and supply chains bounce back. Another key issue that's highlighted in the core body of evidence is the relative lack of digital penetration and financial inclusion in some regions. So large informal populations rely increasingly on digital access to social and financial safety nets. So a positive example of this was in Kenya, that has a relatively well-developed digital infrastructure and wider internet access than some other countries, was able to provide much needed financial services to many hard to reach community members, and stimulated liquidity by doing so. And this was further stimulated by measures such as they waived many of the transaction charges and raised the limits on daily mobile phone financial transactions. So there's some lessons there for the future. Okay, so there are some other, a few other things that I think we thought were really interesting emerging from across the cohort, particularly what we think about, what next. So much research that's come out of COVID-19 has in some ways kind of strengthened the international movement towards building more inclusive social protection systems and health systems. And what's interesting about this particular body of evidence is, of course, it highlights just how important these measures are for building economic resilience of citizens, especially vulnerable groups, including women, youth, and informal workers. So health and economic measures that fail to address these dimensions will fail, we think, to build resilience for the future. Furthermore, the research highlights the need for employing a gender lens to monetary and fiscal policies, the targeting of particular sectors where women are highly represented, such as increasing capital stocks in subsistence farming in Africa, or lowering interest rates in agricultural sectors such as Bangladesh, could have real gender equalizing effects. Core research also looks at the benefits of revamping trade policies and mechanisms with particular attention to boosting regional trade. Trade diversification in the case of the African content, so intra-African trade, could support economic resilience and recovery. And you can see this, some examples of this in the region. There's also some evidence to support expansionary monetary fiscal policies, although these do come with some warnings against high interest rates that it could stimulate. But some more mildly hit economies, such as Uganda's, appear to have successfully alleviated impacts through the reduction of central bank rates and other measures encouraging regulatory flexibility. And finally, core research has highlighted the potential benefits of strengthening financial institutions and maintaining their independence in low and middle income countries. Strong monetary institutions free from political interference can more easily control inflation, implement economic recovery policies, and maintain asset quality, all of which is necessary to respond to shocks like COVID-19. So I will leave it there. Thank you very much, and do explore the briefing and the links to the related research. Thank you.
Thanks, James. Thanks for providing that scene-setting overview of the key issues and emerging lessons that have come out of the cohort more broadly. We'll go next to our project speakers to hear more about the detail, and we'll start with Saira. But very briefly before we do, rather than having a Q&A session after each speaker today, we're going to give you the opportunity instead to feed into a collective word cloud. So I'm going to ask you, as you listen to each of the next three presentations, to think really about what is it that strikes you or that stands out from each of the pieces of research that you're going to hear about, whether it's something that is surprising or something that you've learned that's new, or just really the kind of key takeaway message. And then after each speaker, or while you're listening, if you like, if you go to the link that I've just posted in the chat and add the one word that really stands out or that sticks in your mind. And at the end of the three presentations, and after we've had the breakout group discussions, we'll come back together collectively and have a look at the things that have stood out the most and the different words that people have struck people, and use that as the basis for some discussion. So hopefully that's clear. Just one note to say is that you can only enter one word at a time. If you enter two words, it splits them, and so it won't capture that. So try and think about how you can capture what you're hearing in one word. It's quite a challenge. But next I will hand over to Saira Ahmed from PEP, who's going to talk us through the research that they've been doing under the PEP project, and specifically the learning from Pakistan. Thanks, Saira.
Thank you very much, Jessica. Thank you to the IDRC and IDS team. Pleasure to see you all again. Thank you very much. I am very grateful for this opportunity to represent the PEP network. PEP is the Partnership for Economic Policy, and strongly believes in evidence-based research in the least developing countries. And with regards to the discussion today, we had the opportunity to be funded by PEP, by IDRC, and we actually had this topic that you see right now, which is the fiscal policy response to COVID-19. And the case for Pakistan, actually, of course, it was a tough time for all the countries, and definitely for Pakistan as well. GDP growth went down drastically, and the manufacturing sector was hit hardest. And of course, people were losing their jobs, and it was a very, very I mean, now when I think back, it was really a terrible time, definitely. I mean, you all would agree, and you don't want to think about it again. But this morning, I was just thinking that, you know, it really strikes to me the kind of resilience that economies showed, despite being hit terribly by the pandemic. And definitely public investment played a very important role, which of course, again, declined due to the ongoing crises by 32%, as spending was diverted towards the health needs. So there was a major diversion from public investments in other sectors towards the health sector, and around 3 million people definitely had lost their jobs in Pakistan alone, and the proportion of those living in poverty increased between 24% to an alarming 33%. And after comprehensive consultations with the government counterparts, because PEP has a strong mandate to have inclusive research, which includes government counterparts, civil society bodies, and everyone at large. Our team initiated the study on the effectiveness of the fiscal policy interventions, and I'll just quickly go over the broad questions which we tried to assess in our study. Firstly, we tried to see what were the macroeconomic and welfare impacts of changes in structure and rates of indirect taxes in federal and provincial budgets for 2019-2020, because we were right in the middle of the fiscal year. If you would recall, it was January 2020. So somewhere between, I mean, it's really in between, and it was a very hard time for the governments to cope with it. Secondly, how have these changes provided relief to firms and households? Of course, we wanted to see the grassroots level as well. Then we saw how were changes in tariff policy designed, and how far these measures rescued the firms in the trade sector. And lastly, what was the incidence of production subsidies? How far have had these measures supported firms in the agriculture sector? So these were some of the questions that we were asking, and we tried to simulate this with using the PEP CGE model, which is the which basically gives us the policy experiments that we tried to simulate. Our first simulation was a reduction in sales tax by 3.5% for activities under large-scale manufacturing. Our second one was a reduction in tariffs by 2% on priority agriculture and food items. The third one was sales tax on select services reduced by 3%. And finally, production subsidy allowed to cotton sector. So I'll just skip the technical section and I'll move over to the findings, which PEP would wanted that we should also include gender sensitivity in our analysis, and we saw that there was an 8%. They were it's according to as per our discussions with the World Bank Pakistan office, it revealed how women-owned firms, which are usually smaller than firms owned by men, are 8% more likely to lose their entire revenue during a pandemic. This could be due to various reasons, and in the micro enterprise sector, the uncertainty was much higher, primarily because women are more involved in informal jobs. So informal jobs are always the hardest hit. Because there's no contract as for your job and you're going to lose it. And those women, informal workers who are based at home, may have lost their sources of income completely, as compared to those who were employed in the formal sector. The policy implications which we had for our study with regards to the points that I've shared just now. Firstly, there is a clear need to study the potential of all federal and provincial level taxes in Pakistan and what role these taxes could play in emergency times. Additional simulation exercises and future studies are required to see if cut in compliance cost of taxes may lead to favorable gains. Secondly, given that we see some inequality enhancing impacts of tax policy, because usually tax policies are always criticized for enhancing inequality. Therefore, future exercise could offer insights into what supplementary expenditures or social protection related measures could be expanded to compensate for the increase in potential inequalities. And finally, the tax policy changes amid COVID-19 did not result in a significant export gain. And we saw that, especially for the agriculture and food sector, and this needs to be explored further as this sector was able to see a rise in availability of imported inputs even during the pandemic. Additionally, local inputs were also subsidized by the government. So we see that the government did come about quite a lot in order to a large extent. The government tried its best to resolve the issues and to overcome the unprecedented turmoil and the kind of chaos that was witnessed in the economy. However, after the pandemic, we have even now we can see that there's a huge rise in the cost of living, which I believe has been triggered due to the compensatory measures that were given by governments during COVID. So with that, I'd like to thank you for your patient hearing. And if there are any questions, I'll be happy to respond.
Thank you, Saira, and thank you for drawing out those sort of clear implications and learning and doing so very succinctly. I know it's difficult to cover so much in a short space of time. And so just to say, when we break into groups after the 3 presentations, there will be the opportunity to ask our speakers any further questions you have. And obviously we can link you up post-event if there's discussions that you want to have following on from this as well. I just wanted to remind everyone about the word cloud. The link is in the chat. I can see some some kind of keywords coming in already. So please do take a moment while Conrad loads up his screen, just to think about what really struck you from Saira's presentation and what you might pop in there. Personally, I thought it was really interesting. Although we've got 3 different events in this series, we keep coming back to the same topics of inequality, gender, and how obviously it's the same groups that are hardest hit, and you know, what can be done to reach those most vulnerable and most marginalized. So interesting to see the links across the 3 different spaces as well. So thank you, Saira. I'm going to hand over next to Conrad van Gas from the South African Institute for Internal Affairs, who's going to give us some of the key findings from an African perspective. So Conrad, when you're ready, if you want to load up your screen, and I'll hand over to you.
Thank you. I gather that you can't see my screen.
Not at the moment. Would you like us to load the slides for you?
Let's just see. Oh, I did some apologies. So I did try to do that. It might be an idea if we did as a backup. I'm sorry.
That's fine. All the practicing in the world doesn't guarantee that it's going to be all right on the night, does it? There you go.
Thank you very much. So let me. All right. I've already been introduced. Thank you very much to the IDRC and the Institute for Development Studies for enabling and facilitating us to present our research. I have already been introduced, so if we can move over to the first slide. Just to give you a brief overview of the project, its first phase looked at the vulnerability to the shock and the capacity to overcome and to counter that shock with a fiscal stimulus, and that's the essence of what this presentation will be about. We have done a second phase, which has a look at whether the stimulus packages took into account our climate goals, and the short answer to that is that it generally fell off the radar screen. But we're using the lessons from vulnerability to crisis and the effectiveness of the policy stimulus to try and expand the study in our current phase of the project, which is to build a macroeconomic resilience index with 7 different component indicators, which, if I have time, I will give you a taste of at the end of the presentation. The countries that we've chosen are a heterogeneous bunch. So there's upper middle income South Africa down to low income Benin. There are varying degrees of trade agreements and or customs unions to indicate to be able to identify commonalities in the crisis. So that study extends over a 20-year period and for 12 countries. However, the analysis will be on the 6 core countries. So if we can perhaps move to the next slide. Please excuse me for a sec. Right, so if the graph here indicates, shows the pre-COVID path, indicates clearly the impact of the COVID shock, our recovery up until the present day, and then the anticipated slowdown and with the debt crunch. But what is apparent here is that South Africa was most vulnerable to the crisis, and there are 2 possible reasons for that. One is this very open economy. Secondly, it could have been weakened through a long-term structural stagnation that's related to coal dependence, but also the stringency and length of the lockdown period. Nigeria also slipped into recession. Nigeria's particular issues relate to its dependence on oil, and it's the importance of that, particularly to tax revenue, where during the course of this, as the oil price fell, tax revenue fell from 12 to 6%. Uganda briefly tipped into recession, and here, in terms of COVID stringency, index, this was by far the most stringent lockdown of the countries involved. The other countries' growth decelerated. In Benin and Tanzania, little was done in the way of domestic lockdown, so the slowdown was due to the decline in international trade. And generally, they didn't engage in get very much more debt. They weren't able to implement a stimulus package. But in respect to GDP growth, that seems to have benefited them. On the to drill down a little bit further into the social welfare effects, clearly there have been formal employment losses, which have led to higher unemployment. But much more relevant, as Sarah pointed out, is that the loss of job security within the informal sector itself was particularly severe. This led to food insecurity, ill health, not merely due to the virus, but also to the withdrawal of health services. And in particular, it seems to have impacted on the urban informal sector, whereas in rural areas, there's generally a subsistence base, and that is a source of some resilience in Africa. Next slide, please. So to drill down a little bit, we did a comparison of the change in GDP per capita, not always a decline, sometimes continued growth of that, against the proportion of the stimulus that was directed to social security and to employment creation. So, in most countries, formal sector workers were able to get some level of protection, if only through unemployment benefits. There were loans, concessional loans granted to heavily impacted sectors. This was quite common. Some countries, but notably South Africa, extended grants through to the informal sector workers. So if we add all of that together and net them out, we get the kind of net potential estimate of the net welfare gains or losses. What's coming out here is that South Africa, Uganda, and Nigeria saw net welfare losses despite stimulus packages, which in South Africa's case was quite considerable. And whereas the faster growing economies that didn't have much in the way of lockdown continued to grow, so Benin and Tanzania in particular. That said, if we are looking to conclude that the Tanzanian approach of doing as little as not imposing a lockdown and not getting into debt is the best. Let's have a look at the change in the death rates. Now, South Africa clearly is the highest increase. But Tanzania, when we compare Tanzania and Uganda had a very strict lockdown policy and the death rate did not increase by very much at all, whereas Tanzania's did increase relatively substantially. Not quite sure as to why Senegal's rate is so high, but those are some of the results. Adding to the food insecurity aspect of it, shocks in Africa are often result in inflation. South Africa generally has deep enough financial markets to be, and a well-developed monetary base with which to transmit and control inflation. This is lacking in many of the other African countries. So the outlet for any sort of supply chain shocks, it could work through the inflation rate, and particularly on food. So the premium here can be very high. It's generally higher in most countries, particularly in Nigeria. and only Uganda, where they have relatively strong agricultural support mechanisms, was lower. School closures also relevant, notably South Africa and Uganda. This is a future loss of human capital. A little bit on the fiscal, the attempts to counter this and the capacity to provide a stimulus. Clearly, South Africa, being an upper middle income country, was able to do more than others. The tax to GDP ratio is also important. So Nigeria's is much lower relative to its peers. So then there's the fiscal willingness to take fiscal risk in terms of increasing deficit. And in some countries, generally smaller and poorer countries, and therefore more affordable, to overseas development assistance. Another part of this is a financial stimulus, which basically guarantees for loans that can be concessionalized. This is particularly undertaken by South Africa. This again depends on the depth of the financial markets. In other words, is there a range of short to long-term products and insurance available? Some countries are available, have smaller and poorer countries generally can have good access to concessional finance. So let's move on to the next slide, please. To focus now on some of the policy recommendations, building up the tax base is important, whether it's increasing the rates or improving collection mechanisms. Generally, resource taxes can be very volatile, so income and sales taxes are preferred to provide a more baseline revenue trajectory. These taxes can be made progressive, so they can be made highly progressive. Sales taxes, food and medical products, for example, products products and services that the poor mainly buy, can be set at lower rates or exempted altogether. And then to disincentivize and carbon use, carbon taxes would also be an environmentally positive way of building up the basis on which to stimulate the economy. Equally important to being able to pump money in during a crisis or a recession is to utilize the revenue booms to repay debt, build reserves, and sovereign wealth funds that can then be reinvested into infrastructure. And then when it comes to prioritizing expenditure, basically we have the SDG goals 1 to 4, a sort of basic social security, universal food against poverty, food security, universal health, and education. But these need to be based on the worst case revenue baseline. So in the case where, for instance, with Nigeria, where the tax GDP ratio can fall from 12 to 6%, based on the 6%. Financial measures, this is where these are more regional and approaches on negotiating on the global stage, where we channel SDR allocations to the development banks for concessional finance and insurance products that gear up for the development and infrastructure, particularly the energy diversification. I won't specify, this could include gas and as well as renewables. And then debt restructuring by extending maturities, lengthening grace periods, and reducing the risk premium, which is the basic outline of the deal that has been struck over Zambia. So no haircuts, no haircuts, but lengthening grace periods and extending maturities. I can leave it at this stage if I've ever got my limit, but I'll...
You have slightly, but we can give you 1 more minute if you want to provide any final thoughts, Conrad.
Perhaps if we can just show the final slide, which is our ongoing work. Are you able? So this is the appendix table. This is our attempt to build a macroeconomic resilience index for our 12 countries. 6 different components: fiscal, financial, monetary, human, capital, the diversification of the economy, and governance. We're attempting to create indicators for each of those are the component indicators in the second column, sources. And then generally we expect cyclical responses to that. Fiscal, financial, and monetary responses are more cyclically attuned, whereas there are important structural long-term features such as building up the human capital base, diversifying the economy, and improving governance that are structural ways in which we can build resilience. Thank you very much. I hope that was clear and slow enough for the translator, and look forward to hearing your responses.
That was great. Thank you, Conrad. And really good to see the differences across countries, and really, I guess, highlighting that sort of heterogeneity of different responses. I'm going to give everybody a moment to go and add, if you haven't already, and I'm going to post the link again, to the word cloud on anything that really stood out. I wonder how many people are going to put haircuts in that one. And then I'm going to hand over to Menon, who's going to talk us through the Southeast Asian experience. So whenever you're ready, Jay, if you want to load your screen.
Sure. Thank you. Thank you very much, Jessica. I hope you can hear me. I'm sure you'll tell me if you can't. While I load my screen, let me also thank both IDRC and IDS for having me here today. I want to also say that this is, I was the economic advisor to the IDRC funded project on rapid recovery in the CLMV countries. That's an acronym I want you to get familiar with. That's Cambodia, Laos, Myanmar, and Vietnam. Very exciting region. If you haven't been, I recommend you visit as soon as possible. I was told I had only 8 minutes and 4 slides allowed, or 4 or 5 slides. So I haven't tried to summarize the findings from these very interesting studies that have been conducted by the individual research teams in these research institutes in these 4 countries. There's a lot of interesting results from the collection of primary data with strong focus on inclusion and gender sensitivity. And maybe we can talk about those results in more detail in the breakout session, but I'll refer to them as we go along. Let me now, see if I can move my slides. Okay, it doesn't seem to want to move. Let me see. Okay, yeah. Hang on. Is it moving for you? Yes, okay, there you go. Right, so this is the outline very quickly. So I'll say a little bit about fiscal policy, which is the theme today, during COVID-19 in the ASEAN or Southeast Asian region. For those of you not familiar, these are the 10 countries, including the 4 Indochina region countries. Then move on to talk a bit about policy lessons for dealing with future pandemics and a bit about future proofing, again coming back to the theme. But I also want to pick up on these ideas that have already been mentioned, where they've already been mentioned, I will just skim over them and then try and focus in a bit more about how we deal with future pandemics in a way that will minimize the economic and health impacts. And I want to make the point that in many of these LMICs, and certainly the CLMV countries, which are very poor countries, there is very little difference between health and economy. So it's a false trade-off to think that you can do more of one for the other. For the poor, the economy is what determines their livelihood. So lives and livelihoods are one and the same very often for the poor. So that's something I want to come back to. But let me start off by showing you this picture about the spending stimulus as a share of GDP across the ASEAN region. And you can see there's quite a bit of variation. Rich countries like Singapore, where I am at the moment, could spend more than a quarter of their GDP to support businesses and families and individuals to cope with the pandemic. Malaysia, which is the country I was born in, comes second, also quite a high share. But then things start to fall sharply, especially amongst the countries in the study, the CLMV. It's negligible in Laos and Myanmar. Vietnam spent a little bit more, 10%. Cambodia, surprisingly, for a very poor country, managed to cobble together about 8% of its GDP. So there was very little really in terms of resources available to be spent. That's a reality of their stage of development, and that's something we have to accept. But what was available was actually spent quite well, I think. There were challenges, logistical challenges in getting the money to the right people, in avoiding leakages, as they say, which is basically corruption. And there's enough of that throughout the world, not just this region, but it's a problem, of course, especially when, governance is weak and institutions are weak. But for what they had, I think they did a relatively good job. But they cannot rely on resources alone. Like we heard from Conrad in Africa, the capacity for these countries to raise tax revenue is limited because the only people they can really tax are large companies. Incomes are low, so individuals hardly pay any tax, and collection mechanisms are weak. But more importantly, a lot of MSMEs are in the informal sector. Again, we've heard this from the other presentations. And a lot of workers are also employed informally. Many of them are migrant workers, but also they include local populations. So they fall outside these limited social safety nets anyway. The resources are limited, and whatever is available, I think, is spent well, but a lot of people are not covered by even those limited social safety nets. So the lesson for these countries for the future is there's not much they can do structurally to really make a big difference in terms of limiting the impacts. And then it comes down to lockdown policies. And that's where I think they can minimize the impact on both health and on economy. And like I said earlier, I think the lives versus livelihoods so-called trade-off is not a real trade-off in very poor countries. There was a fantastic, I couldn't find it, but I had it at some point, fantastic sign in a very poor part of the Philippines, Payatas, which read, feed us or free us, basically. So you're going to force people to stay at home without, these are scavengers who live hand to mouth, day to day. If you tell them you cannot, leave your homes to feed yourselves, they will break lockdowns. So the efficacy of lockdowns without when you cannot pay people to stay at home is compromised by definition. And this is what we have seen. But countries will do a trade-off. And when they do that trade-off, I think they need to think sensibly about domestic versus border mobility restrictions. I think what we saw was an incredible bias against the border. Border restrictions were the first to be put in place, if you recall, when the pandemic started, and that was understandable. But then they were also the last to be taken away. That was not understandable, right? And that was clearly a bias against the border. In fact, when it became quite clear that border closures were not doing very much to prevent the spread of the virus, they still remained unchanged. And even when it became clear that the new strains could not be kept out with border closures, they still remained closed. And the cost of those border closures to these countries that are highly trade and tourism dependent was very high. Right? In Cambodia, for instance, up to a quarter or more of GDP is generated through tourism. And a lot of those jobs go to the poorer segments of society, and they were devastated by the border closures. So I think we had a lot more easing of domestic restrictions because borders had to, for some reason, remain closed, right? So you had this economy versus health sort of balancing, but then within the economy, you have two instruments. You have domestic mobility restrictions and cross-border mobility restrictions. Apparently, border restrictions could not be played with at all, even when they didn't seem to be doing much. They had to remain closed, and then you had to try and ease domestic restrictions more and more to try and help the economy. And in fact, I think that led to a greater spread of the virus than needed to be the case. So this asymmetry, I think, needs to be understood and recognized as bad policy for future pandemics. There are lots of reasons for this border bias, but whatever they are, they need to be overcome, I think, in time or before we face the next pandemic, and allow for a better rebalancing. And in these countries, the biggest impact on both health and the economy came from the length and the severity of lockdowns. To give you one example, if you look at Philippines and Indonesia, they both Philippines had a very strict lockdown that lasted quite long. Indonesia did not, because they recognized that that the lockdown could not be implemented in any realistic way because the large share of the poor. So what we found was both countries had a huge outbreak in the early stages of the virus in the early stages of the pandemic, but Philippines had a huge economic downturn, which had a bigger impact on health outcomes than the virus itself. And Indonesia had a mild recession because they did not lock down in the same way. Similarly, Vietnam was the only country in the whole region that avoided a recession because they had very targeted measures put in place and for very limited periods of time. So I think that's the takeaway for countries that can't do much with their limited resources. They need to get the policies right. There is a role for containment measures like lockdown, but if you are going to implement that containment measure, then the bias against the border should be reduced or removed. And you should not overdo border closures in trying in somehow imagine that you can keep the virus out or new strains out. Even New Zealand and Australia that almost completely shut their borders could not do that. Now, let me move on to the last point I wanted to make, and that was in terms of future-proofing. And this brings me to the Sustainable Development Goals, or the SDGs. And I think in the CLMV, but also in other countries, perhaps all countries, the impacts of the pandemic were made much worse by the fact that these countries were falling behind their targets before the pandemic hit, as you can see from this chart, especially those on health and social related social insurance, social protection, and so on. They were falling behind the targets. To give you one example, you know, per thousand population, Cambodia has only 0.7 hospital beds, right? When the OECD average is 4.7, right? So, you know, this is a huge gap to be filled. But they were falling behind their targets before the pandemic. This made the impacts of the pandemic a lot worse, which is now making them fall even further behind, right? So we've got a vicious circle operating here that we need to try and break, right? The scarring impacts of the pandemic are very real in these countries. They were only reduced by the fact that they opened borders. Well, Cambodia was the first actually in the region to open borders and thereby limit the economic scarring. But then the fact that healthcare systems are underinvested meant that you know, you had less leeway with lockdowns as well, right? You had to you know, tighten more frequently because there was less room to work with in terms of flattening the curve. And as I mentioned, the lack of access to various essentials and basic needs like running water meant that lockdowns could not work and were bound to be violated because people will not stay at home and starve to death just because you say there's a pandemic on. People will break lockdowns in those conditions if you cannot provide them with social support to keep them at home, surviving on otherwise, you know, not being able to survive. And the lack of, I think, access to digital infrastructure also increased the impact of school closures. And this is now, you know, creating an intergenerational cycle of poverty. So the pandemic not only reversed a lot of the gains made, some of them say that the gains of, you know, more than 10 years in reducing poverty, but worse than that, it's gone intergenerational now through things like you know, the loss of human capital and so on, through school closures, and made worse by the fact that they could not access alternative forms of education through digital means because of limited infrastructure. So I think I've gone much over my time, so let me stop there, and I look forward to the discussion. And back to you, Jessica.
Thanks, Jay, and thanks for providing that overview. And yeah, in particular, I was interested to hear about you talking about how you know, the sort of underlying progress towards SDGs either does or doesn't help build resilience to these crises, and then that kind of vicious cycle that spirals from it. So yeah, lots to think about and lots to take forward. So thank you to all three of our speakers. We are going to now break out into some groups for smaller group discussion. And in a moment, you will be automatically assigned to a group. And I think you'll just have to click the option to join when prompted. Each group will have one of our three speakers in it and an IDRC or IDS facilitator. And then we'll come back together at the end of those groups in around 30 minutes. Back into the plenary to have some final discussions. So Laurie, when you're ready, if you want to open the breakout rooms, please. This is the point where I do a little dance to fill time while the tech catches up. If there's any burning questions or clarifications for any of our three speakers, then feel free to raise a hand while the groups are being allocated. Or if you haven't yet added into the word cloud, I can see a lot of additions within the word cloud. People might want to switch around rooms.
Migrant populations being the most vulnerable, but particularly for an sort of regional or intergovernmental approaches. So this is where global safety net would be most relevant. I think, oh yes, the importance of disaster management planning within our general suite of development plans. So for example, only 2 of our cohort mentioned this as an issue. So it's sort of general beefing up of disaster management plans and their inclusion in the development planning process. The impact on social cohesion. So this was raised as the generational gap that's emerging in particularly in West Africa, in Nigeria and Senegal. And then a further exploration, as James mentioned, on the urban-rural differences. So not only the subsistence base, but the relative density of housing was brought up as an issue, both in the spread of disease and in the ability to contain. Hopefully I've covered the issues that were raised in the discussion.
Thanks very much, Conrad, for stepping in and providing that feedback. And for group 3, I think it's
me.
Edgar.
It's me.
Yeah,
that's right, James. Thank you very much. And we also have a lively discussion, and I tried to group it in 3 major headings that not a big surprise for the audience today. But one is elaborating further the point that was well made by Jay, that some of the excessive lockdowns, the way in which the initial responses to COVID went by governments was a lot harder than it should have been. And is this a key challenge? And the comments came down to that as well. The fact that trying to disentangle health and economy is not really something feasible, especially for very poor economies where livelihood and their lives and their health is the same. It was very damaging, especially for tourism-dependent countries in the region, in the Mekong region, which includes Cambodia, Laos, Myanmar, and Vietnam. And this didn't have to happen like that way. So for the future, looking at breaking this vicious circle in which we had a very tough response, but we didn't realize that was a scarring or that would have a long-term consequence for the country. We have to understand that long-term impact. There is now an intergenerational damage that has been done by the lockdowns. For example, education in countries of one extreme has been Myanmar, but many others in which generations have now been without education, and that will have a long-term impact. So it's trying to invest in that foresight, in that fiscal responsibility. Some of the reasons, James, what you haven't heard, probably some of the common slang words that we would have used to describe this is that they are not only one word, but two or three, like fiscal responsibility, a sound fiscal management, and so on. All the things that you need to have, and that governments need to continue investing on, and how they are some of them, they received donor assistance, which it was fine, but some of them also were working hard at building their own resources. And the case of Cambodia was mentioned, in which they did invest in widening the tax base just before COVID, and that gave them enough respite to be able to have some of the support that Jay had already mentioned, that was more than 10% of the GDP. That was not necessarily common in other poor economies, definitely not the case in Myanmar, which is 0.1%, and where the political situation has really wiped out everything else. So that first point is, how do you manage to break the cycle? If you have very poor investments in society, when the shock happens, that puts you on a bad path already. And not investing enough to meet the sustainable development goals, it's a really good point. It shows how difficult that is, and how for long-term growth. So that's a big point to bring to the future, of continue looking at the future. Investments in health equals a lot investment in the economy. How can you actually do this better? So that's the first point. Second one, it's on the gender focus. There was a lot of discussion about or not a lot, but probably it's because in this region, Southeast Asia, female-owned businesses are so common. It's commonplace around the region. But it's also the fact of what you just mentioned, that there's been a lot of, the burden has fallen a lot on women. So you had a clear case in which you were damaging the well-being of women as well, and their families, and the health of their families, together with the economy. So that it's something that moving forward, it's in the case of Cambodia, we mentioned the need for further engagement with private sector to figure out ways in which a care economy or care policies can actually be taken into account, since women are such a big provider of care, that allows, in the case of health crisis, it has allowed the family to subsist. But also in general, it deepened a big inequality that was already in existence. So how do you overcome that? There was no clear answers necessarily. I know ADB and others have been looking at the care economy, but how do you actually emphasize or inform policies that will support women, their physical and their mental health, to go through a crisis is yet to be researched, and that's where probably a lot more emphasis should be put on. A third and last point I want to make is, how do you, I was pushing a little bit the conversation on who would need to be engaged, how we can do these things differently next time around. Again, the idea of engaging with with the stakeholders, not only with government, but also with civil society. And that, in a way, it could sound naive, but it's also very important that you have these different groups talking to each other, including the research community. The research community could, in this particular case, and some critics could say that we were too isolated from the actual policy discussion. And in the case of Southeast Asia, actually, there is some case being made that the social scientists were really kind of on one corner and the policymakers on the other, and civil society, or the society as a whole, was suffering the effects of the pandemic. So that's something to look into. How do you engage into research? How do national research councils play a role? How do private sector community plays a role? And how do they actually discuss or get prepared together on a common vision to cope with disasters or with the next pandemic? Collecting data is one of the cases that was mentioned for Vietnam, in which the government reacted pretty quickly to take the pulse of the economy, society, enterprises. And this is something that was very well done in the case of Vietnam. Our friend Phu Nguyen, who we did not have enough time to devote to her intervention, she presents two clear cases in which the MOLISA, the Ministry of Labor, and the Ministry of Finance have been trying to find ways to alleviate the economic burden of the crisis on the population of Vietnam, which, by the way, was one of the star cases in the Mekong story. I stop here, James.
Thanks, Edgar. That was extremely thorough. Thank you. Very helpful. Sounds like a great discussion. So I'm just about to hand over to Menon Bordelot, who's going to provide some closing remarks on behalf of IDRC. But before I do that, because I'm worried people will sneak off, I must remind you all, this is not the last event celebrating the learning coming out of the core programme. There is another one of these fantastic webinars this very Thursday at the same time, focused on equitable support for livelihoods and food. And this has been such a big theme for the core cohort. It's been so important right from the off. This programme was delivering really fascinating learning on both livelihoods and food. And of course, a lot of this cuts across what we've discussed today. There's a link to register for the webinar that's just gone into the chat. So please sign up, but also tell your friends, because it's going to be really good. And it's the same time as this one today, but just in 2 days' time on Thursday. So I'm now going to hand over to Menon, who's going to kindly provide some closing remarks. Thank you.
James, sorry to interrupt. Can I make one quick point?
Please.
Yeah, just very quickly. I think Edgar has done a great job summarizing what was discussed in our group, but I just want to make a quick point on the issue of reverse migration that both your groups raised. And I think you mentioned that this is increasing the burden on women in terms of providing care and also on housing. But there's another factor which a former colleague of mine has done work on in Indonesia, where this reverse migration it actually depresses agricultural wages in the rural sector because of the increased supply of labor, and pushes incumbents into poverty as a result. And they don't have to be employed in wage labor. You can think of a commodity equivalent of their work output. So it doesn't have to be paid labor, is my point. And this actually has increased poverty in Indonesia. This is some work done by Peter Waugh from the ANU. You could Google that, I guess. And I think that's another concern, because often it's said that the rural sector has done a lot better than the urban poor. But this one effect, actually, of reverse migration has depressed wages to a point where it may have actually increased poverty. Sorry, I just wanted to make that point.
That is absolutely fine. Thank you. It's a very important point, and it's clearly another area of potential future research. And actually, it does resonate with some of what's going to be discussed on Thursday, because I know that issue of the suppression of wages in rural areas as a result of the pandemic and reverse migration is touched upon by some of our, will be touched upon by some of our speakers on Thursday. Right, over to you, Menon. Please go ahead.
But great to see those conversation going on. So for those of you who do not know me, I'm Menon Bordelot. I'm a program officer with IDRC, and I've overseen the coordination of the core initiative for the last year. So on behalf of everyone at IDRC, I wanted to thank you all for taking part in this closing event, which for us is actually one of the last steps of a learning journey that began in 2020. So as we all know, CORE began at a time of great disruption that made almost all steps of a global research initiative like this one difficult. Plus the thematic focus of the socioeconomic impacts of the pandemic, they were evolving so fast and unevenly around the world as projects were also progressing. So not an easy task. But as we've heard today, CORE has been performing very well. And as a funder for research for development, we, being IDRC, must continually review our approach and our strategies to achieve impact, even in those difficult circumstances. So the core initiative has also provided valuable learnings on how to improve the effectiveness of future rapid responses initiatives. And it's not done yet. We will keep reflecting in the fall on what we've learned across IDRC as we will design next year's strategies and ensure better preparedness for future crises through the development of localized research agendas. So thank you again kindly for your presence and your contributions to the impressive and growing body of knowledge from CORE, but also from your inputs on what are the key implications and considerations for future works. So the what we do next is very much on top of our minds right now. So again, thank you to everyone, also my IDRC colleagues and the IDS team who organized the event series.
Okay, thanks so much. So we're closing now, and hopefully we'll see some of you on Thursday. Thank you for joining. Goodbye.
Thank
Thank
you.
you.
Everyone.
Thank you. Bye-bye. Bye-bye.